going on, everybody? This is Between the Game Sports, and this time I believe we're out in Birmingham, Alabama. I've been knowing this camp for about 18, 19 years, I think,
Mm-hmm.
something like that. And we haven't spoken in a long time, but it's still love. He's now a sports medicine doctor, Dr. Calvin Spellmon. What's going on?
Everybody, how y'all doing? How y'all doing? Big Willie Star, how you doing, big guy?
Same old, same old. Shasta said, Shasta said to call you a nickname, but I'm gonna let you make
Chuky.
it. Yeah,
Chuky.
Chucky, it's still there.
I was trying to figure out the other day how I know Shasta gave it to him. I forgot how I even got that nickname. He just took off.
I don't even remember either. He might jump in. I don't know, man. But we're gonna jump right into it, and as soon as I can find these questions, uh, that's not right. Okay, there we go. So tell us a little bit about yourself and how you became a doctor and stuff like that.
I got you. Well, so initially, I went to, like I said, Will said I met him had to be about 99, 98, 99. I transferred
Something like that.
from Dallas to Houston, back to Houston. That's
Hmm.
when I met the guys playing basketball. I eventually graduated and went to Dillon University in New Orleans, Louisiana. Shout out DU. I played basketball there for 3 years, and while I was there, I majored in biology, pre-medicine. Like most people, I didn't get in medical school right away, but my professors were astute enough. Every summer, I did a summer research program, and one of the research programs I did was in actually Los Alamos, New Mexico. Most people probably haven't heard of it, and I worked at the national lab out there. So after my senior year, I actually had a year left eligibility, but I graduated and I was working at the lab for the summer when Katrina hit. So I just ended up working at the lab for about another year and a half, and then I went matriculated to Meharry Medical College. Since I had been out of school for a while, and I needed to retake the MCAT. I did a post baccalaureate program. Got me ready, and actually taught me a lot of test taking skills that I lacked. Although I was a great student always through school and college, being able to get ready for medical school and things like that, you have to be a critical thinker. You have to have great test taking skills, and so this program actually helped me with that. And then I matriculated into the medical school class at Meharry. I graduated in 2011. I actually did my initial background in pediatrics. So I did my residency at the University of New Mexico Children's Hospital in Albuquerque, New Mexico. I did a pediatrics residency for 3 years, and then I did a chief resident year for a year. And then I matriculated to the Campbell Clinic, specializing in orthopedics in Germantown and Memphis, Tennessee. And that year, that's when I did my sports medicine training. And while I was there, I worked with the Memphis Grizzlies, the Memphis Redbirds, University of Memphis, Christian Brothers, Rhodes, several high school and local athletes. We did the St. Jude Marathon, just getting a lot of hands-on sports medicine exposure. And then I moved to Birmingham, Alabama, where I've been since. And here I work with a sports medicine group called Precision Sports Medicine Orthopedics. We take care of obviously athletes, but we also take care of just everyday people with aches and pains, and I take care of them from cradle to the grave, dealing with sports medicine and musculoskeletal injuries. And then I also work part-time at the emergency room at the Children's Hospital here as well, just keeping my feet wet in a pediatrics realm, trying to keep those skills fresh too. And so that's pretty much my background, how I got to sort of to where I am right now.
Okay. You're also a certified pediatrician, correct?
Correct.
Yeah. So how was that route?
That was what I did initially. So at the hospital, that was I always had a passion. Actually, initially I wanted to be an OBGYN, Dr. McCosby, so I wanted to be Dr. Heathcliff Huxtable. That was my dream. And then when I actually did a rotation in medical school in OB, we had to go to the women's prison, and that changed my life. I was done with OB after that rotation. So then I decided, I've always loved kids. I've always loved sports, so I decided to do my residency in pediatrics. And then from there, I bridged my two passions of sports and children, and did the sports medicine route. And like I said, I'm able to still practice the pediatric portion of it because I work at the hospital. But I also do a particular type of sports medicine. I do something called primary care sports medicine. So when I work with my athletes, for example, I'm the primary physician for University of Montevallo. I also take care of Jefferson High School, and I help out with several other high schools and colleges. Not only do I take care of the athletes from a musculoskeletal standpoint, so if they get any injuries, but I also deal with their regular medical problems, such as if they have asthma or anxiety, depression, or sickle cell disease, or sickle cell trait, or type 1 diabetes. So I also deal with their general medical problems while they're still being an athlete. And so that's the uniqueness of what I do from that standpoint.
Understood. Shaston is on, and
Uh-oh.
he made a comment. He said you were standing next to James Nwobo in the gym, and everybody thought y'all were brothers. So they all looked alike, and Chuki was the first thing that came out of his mouth. So say he thought you was African.
That's good. I keep my roots, baby. I keep my roots. I ain't got no problem with it.
So we're gonna jump right into it, man. And the elephant in the room that's going on around the nation, and whew, it don't look like it's going anywhere anytime soon. COVID-19, the coronavirus. Um, there's a lot of people that's still trying to do youth sports and high school sports, and each state has different mandates to it. What are your recommendations with dealing with COVID-19 youth sports?
So obviously, nobody. It's a novel disease, so we still learning different things about it every day.
Uh,
But there are many theories out there of how it got started, and everybody's entitled to their opinion in their respect. But the fact of the matter at this particular day and time that it is here is real and it's prevalent. Um,
mhm.
and while it's true, for the most part, children tend to deal with it better. They don't have chronic medical problems. They don't have underlying medical illnesses, and so they tend to deal with it better. It still does not mean that they're immune to it. They still get sick from it. They still get hospitalized from it. We still have had some pediatric deaths from it in youth sports as well. And I think in certain sports, I think it could be okay to return, and those would be my sports where you have minimal to no contact. So, I think golf, obviously, tennis can do it. I feel as though in baseball and softball, to a certain extent, can do it. Certain track and field things, I think, can manage it. But as far as my contact and collision sports, football, hockey, basketball, soccer, things sports where you have to touch one another, I think those sports are going to be a little bit harder to do and to come back to, not knowing enough about this virus and how rapidly it's spreading. And I think in this day and age, I would err on the side of caution. I would be more safe than sorry. So if if it's not dire right now, I would protect kids. They can still train, they can do individual things, and they can do non-contact things. But I think until they get a better handle on it, I would protect kids from participating in these sports. And on top of that, like we're seeing right now, several high schools try to open back doors and try to get back going. But as soon as a kid tested positive, they had to shut down for 2 weeks and things like that. So, we're rolling around getting school started back, and I love sports more than anybody, and I want to see it back, but I want to see it back safely. What happens if a kid tests positive on a football team? What happens if a coach tests? We quarantine the whole team, that players, we shut down the games. I mean, how do you work through that? And I think it's the same situation we're kind of dealing with now, trying to figure out how to send kids back to school safely. And I just don't think we have a good answer right now. And so
Exactly.
I would tend to be more safe than sorry right now and be hesitant to send my kids back to participate in contact sports right now.
I get it. This is part of the reason why I stepped away from AAU this year, and it was a tough decision for me. I know out here in Texas, our government, the governor is saying stuff like 10 people inside of a building. What are y'all kind of uh, requirements out there in Alabama?
I think the requirements in Alabama have been fluid. Actually, the governor came out today and she just made a statewide requirement for everybody to wear a mask. And
Mhm.
we are under safer at home orders, so people can still go out and about and do things. And they're asking, restaurants and different establishments of that nature to limit their capacity, to make sure they social distancing and things of that nature. But the kind of the same thing y'all seen in Texas, Florida, and different places around the country. Some people are doing what they're supposed to, and some people are not. And so
Exactly.
I think I think that's the issue with it. Everybody has their own opinion about the situation. Everybody has their own opinion of what's best for everybody else. But in reality, everybody's really just doing what they think is best for them. And I think that's the problem that we're running into. And
Yeah.
so until we all kind of get on the same page and try to approach this thing as a unified country, I think we'll continue to have problems, and we'll continue to see things where we have issues starting back sports and starting back schools because people just don't want to, in a sportive team, come together and do what we're supposed to do.
Exactly, man. Everybody thinks they're more important than the next person, which I get it, man. It's their right, but I chose to back out of that. You spoke on training a little bit during this time, and I know everybody wants to create the next LeBron or the Kevin Durant, and in baseball. Can't even think of players right now. The dude from the Dodgers and the dude from the Red Sox. Um, but do you think kids need to retreat on training? Do they overtrain too much? Or what are your thoughts on that?
Oh, absolutely. As a matter of fact, there's something called overtraining syndrome. Like there's a condition that can develop from kids training too much. So, when we were growing up, we didn't train. Like we got out there, we played. Sun up, sun down, we played. That was our training.
Yeah.
Now I see a lot of kids, and you go around, you drive around the neighborhood, you go around a party. You don't see kids outside playing sports anymore. They inside. They're actually doing training sessions, which to a certain extent is okay, but you still need experience. And so I think there needs to be a healthy combination of experience and playing and then training. And then another thing I'm seeing that's been bothering me so much is you have these trainers that are doing things with kids that have nothing to do with the sport that they're playing. And so then the kids go out there and they don't get the results from all that time and effort that they've been putting into training because they're training for something that they're not even playing. So that's been a big pet peeve of mine as well. And I see a lot of people, they training year round. And I relate to my kids this way. I'm saying my professional athletes, my NFL players, NBA players, baseball players, they all have off seasons. They take 2-3 months out of a year where they, you see LeBron and his crew on the banana boats. They go out of town, they relax, they spend time with their families, they take time off away from the sport. And so I presented to them like, if my professional athletes have to take time and rest from their sport, you as a child and as an adolescent, what makes you think that you all don't need that? And so it is absolutely too much training for these kids. And it shows. You seeing baseball players, teenagers with Tommy John surgery blowing out their elbows. You're seeing young athletes, significantly more knee injuries and shoulder injuries and ankle injuries and concussion. It's too much training and it's too much of one sport.
Yeah, even when I was doing training, I had to kind of take a step back and figure out what needs to be done and when can they relax and stuff like that. I tell parents all the time and let your kids enjoy being a kid. So and that includes rest, which is my next question. I think you kind of spoke on that a little bit. How for me, I never rested. I was always up. I still am. But for an athlete, how important is rest to the body?
I'll present it to you this way. Can you drive a car without gas in it? Can't go nowhere. But rest, you have to rest. Rest in a great diet is adding fuel back to the tank. If you don't get proper rest, your body is going to break down. If you don't put the proper fuel into your tank, your body is going to break down. You have to allow your body to rest and rebuild and rejuvenate. If you don't allow your body to do that, it's eventually going to break down on you. And I tell kids all the time now that it's harder to get through them sometimes because we all were at that age where we felt invincible. Nothing happened to us. We just had that. As a teenager, that's how you feel. But I try to explain to them the same body you have as a 13, 14, 15-year-old, that same body, you have to live with that body for the rest of your life. So if you don't do the proper things to it now, if you beat it down right now, you will pay for that later. And I see that so often in my clinic. I see so many of my patients like that. They put their bodies and things through the ringer when they were younger, and they paying for it now. And so rest is one of the most important things. These athletes in general, they need rest. They have to get it. You need days of recovery. You have to have it.
Rest in the water is always my thing for athletes. We have a question from Angel. She says, are there specific training regimens you recommend for people that are into basketball?
Yes, and obviously I played basketball. Obviously, I played in college, but I'm not an actual basketball trainer. But I will say this: basketball is a fast twitch sport, so you need to do things that activate your fast twitch muscles. You need to work on hand-eye coordination. So you got dribbling, shooting, passing, footwork, agility drills. Those are the type of things that you need to particularly do in basketball. A lot of people do a lot, strength training, but you don't have to. It also depends on position, but you don't have to be big and bulky to try to play basketball. As a matter of fact, as an example, a lot of people watch the Jordan documentary. He particularly mentioned it when he went to baseball. he had to completely change how he trained and how his body was. And then when he went back to basketball, that was the biggest thing. He had to turn his body back into a basketball player. Every sport you play, you develop in different skill sets, different muscles, different routines, different habits. And in some sports they overlap. But for basketball in general, like I said, you need to put drills in where you're working on shooting, dribbling, passing, footwork, hand-eye coordination, agility drills, fast quick muscle drills, things of that nature to get you ready to play basketball.
I've witnessed some of the stuff you talked about earlier about trainers doing stuff absolutely nothing that has to do with the sport, and I've been a victim of that. But I use that mostly for a warm up. I've seen kids go through training and they do stuff the whole time, nothing to do with their sport. I'm just sitting there like, wow. Uh, when, when are you going to work on a basketball skill? So it's crazy, man. There's trainers everywhere. I can't judge anyone, but it's not for everybody.
It's not.
One of my boys said, was talking about he didn't take care of his body very much, and he says he's paying for it every day. Said I'm paying for it now. I can't even get up out the bed without making the noise, and it's crazy to me. I never thought. I remember making fun of my parents and my dad. They putting on icy hot and everything else, and I'm like, man, I'm never gonna get to that point. But shoot.
I used to say that, playing after, college, start playing in these, leagues around the cities and things like that. And I was the young guy on the team at the time. I used to see these older guys putting on the strongest smelling ointments in the world. I told myself, I said, look, if I ever get to that point in life, I'm just gonna hang it up. And so now I'm at the gym and I'm the older guy on the team. I gotta get to the gym an hour early just to warm up to be able to play. But I found a scentless ointment so I can keep it going, man.
You gotta find a way to keep it going.
I gotta find a way.
So overtraining is something we just talked about, and I know that's a mistake that a lot of parents and players make. But what other type of mistakes do you see parents regarding their child's health with athletics?
So I kind of mentioned earlier, but one of the biggest things I see now is parents having their children specialize in a sport too early. So they start playing a sport at 6, 7 years old, and they playing it year round. So you got a kid from 6, 7 years old playing baseball year round, doesn't play any other sport, and they playing on multiple travel ball teams. And then by the time they get to school, they're playing on the school team and travel ball teams. And I tell them, you're setting yourself up to be injured because you're putting too much stress and strain on your body without enough rest, without enough recovery. And then I use an example for them too. A lot of professional athletes, if you look back when they were in school, these athletes played 2, 3, 4 sports. So they played basketball, baseball, track, wrestling. They did multiple things. And then later on, they decided to specialize. But a lot of parents now think that, well, if I want my kid to be the next such and such, the more the better. So they have to train more. They have to train hard. They have to play just this one sport in order to make it in this sport. And that's absolutely not true. They need to play multiple sports, develop multiple talents, develop multiple skill sets. And then when they do decide to specialize, everything that they use to train them to get their bodies in shape, and those skill sets will transfer over. And they'll be fresher, better athletes because of it. But that's one mistake I see. The second mistake I see a lot of times is I see a lot of parents put pressure on their children, essentially trying to live their dream through their child. And so you have a lot of kids that don't even want to play a sport. I see a lot of times they either fake injuries or they drag injuries out just so they can have an excuse not to go back and play the sport. So I tell my parents, don't put that pressure on them for a lot of reasons. But another reason would be if they got a kid out there that really don't want to play, and he out there or she out there and they half going at it, but you got another kid that's their passion, they going hard, that's going to set that kid up to get hurt. And so parents need to stop putting pressure on their children to live vicariously through them. They need to enjoy their children playing sports, enjoy them for what they are. Stop trying to make them the next, like you say, LeBron or Mike Trout or whoever. They need to be the next them, and the parents need to accept them for that. Now, obviously, I want the kids, if they don't play, give it your all. Give it 100% every time you go out there. Do your best. Obviously, all that good stuff that you learn in sports. But the parents got to understand, like, this is the child's life, and they have to live their life. It can't be lived through the parents.
Yeah, I do. out of Houston named Jimmy Hicks. We call him Cheat Sheet. RCS Sports. He always call it. We call it parents going wild. Parents going wild. PGWs. This is why you see those parents on the sideline that are losing it, can't enjoy the game, attacking the referees, attacking the coaches, and they're not allowing their kid to enjoy being a kid playing a sport that they might, grow to love. And it's definitely tough. Parents just kind of take a step back sometimes.
Yeah, and that's why I tell parents, when the kids are young, have them dabble in some of everything. Have them dabble in music, have them dabble in all types of sports and activities. And then whenever they find their niche or what they're passionate about, you foster their development. But don't put your passions and your desires on these children because they're going to pay for that later on.
What still to this day, I still hate doing this, and I know I need to do it more. But stretching is one of my least favorite things ever. But I remember my college coach said that Kareem Abdul-Jabbar and I want to say Robert Parrish that played for the Celtics, they credited their long careers to stretching. How important is stretching and just in general, and then after an injury or whatever it may be, being soreness, how important is it to recovery?
Stretching is probably, right next to conditioning and preparing yourself to compete. Like stretching is right up there. It's like if that's 1A, stretching is 1B. And I tell, when we were coming up, we used to get out there and play. If we did stretch or had stretching before practice, we out there just talking about the day or whatever. We just do.
Yeah.
Then we get out there and play. But again, like you said, now we paying for it.
Yeah.
So I always talk to my athletes about, number one, a proper warm-up. And so a lot of athletes, they go wrong because they do static stretching. And so what do I mean by that? So if you go out and you hadn't warmed up, your body's still tight, your body's still cold, and you just go to stretching, that's static stretching. You need to do dynamic stretching. So basically that is you moving while you're stretching, or you warming up and then you stretch. So get a 5-10 minute light jog, jump rope, get your body warm and get it loose, and then you need a 15-20 minute good stretch, good warm up. And then you participate in practice or your game, and then afterwards you should do a cool down stretch to settle your body down again. And even on days you don't compete, on days you don't have practice, you should make it a habit. It's sort of like meditating. Like, you should make it a habit to stretch every day if you're able to. Your body will thank you for it, and the older you will thank you for it. The older you get, the harder it will be to get that flexibility. And that's why I even agree with like implementing yoga programs for young athletes. Like if they can do some type of yoga program, it just gets their body prepared, and it also protects them in the long run.
Go ahead.
You mentioned about like I said, in recovery. So again, that's things that we necessarily didn't do. We may have iced it, we hurt something, or this and that, but we never thought about recovery. Obviously, we know better now, so we do better. But you have to let your body recover. And again, that goes back to what we spoke on earlier as far as rest. So even if you're not injured, but you just had a rough game or a hard game, especially sports like football, you have to let your body recover. And that's another, situation that, like I said, that we're dealing with now. A lot of these athletes were off for several months with the coronavirus. And so then when they opened back up these facilities and letting these kids get back to going to practicing, they were so anxious. The coaches too, they were so anxious and so antsy to get them back out there. There's a lot of injuries because they're not taking the proper precautions to recondition, to re-warm up, to re-stretch, to get back in, athletic shape. And they're paying for that. And so you have to let your body recover. You have to do a proper warm-up and cool down. You have to treat everything that you do in regard to a sport, you have to approach it as if, it's the most important thing you're doing at that time. So whenever you stretch at the time, that's the most important thing you're doing. Whenever you're warming up at the time, that's going to be the most important thing you're doing. Same thing. And then when you compete at the time, that's the most important thing you're doing. And after you compete, recovering will be the most important thing you're doing. So if you approach it that way, you just save yourself a lot of harm down the line.
Understood. Parents and players, I hope that you're listening. Don't be like me. Start off early. Start off early and get into the joy of stretching, man. It can save you a lot of aches and pains as you get older, because that's what's going to happen. You're going to get older. You're not going to be young forever.
Undefeated.
And, undefeated. And so kind of spoke on that with injuries and stuff like that, when players getting right back out there from this. Uh, what can be done to kind of decrease the severity of an injury, kind of prevention, I guess you can say?
So in some situations, it depends on what the injury is, but for the most part, again, conditioning and preparing to compete will be of utmost importance. Again, you wouldn't go out here and run a marathon without preparing. You gotta look at sports that way too. You don't need to go out here and play these sports if you haven't properly conditioned and trained for them. Especially we're in the summertime now, we see a lot of heat injuries now, heat strokes, dehydration, things like that, because the body needs to it needs to get conditioned for the type of heat and the type of training that's going to go through. You see cramps and things like that. Certain injuries also can be prevented with proper body mechanics, and that's what a lot of people don't talk about. For example, young ladies, young female athletes, they are more prone to tearing ACLs simply because of their anatomy. So their pelvises are a little bit wider. A lot of times the notch that the ACL goes through is a little bit more narrow. And women tend to be more quad dominant when you need your hamstrings, that muscle in the back of your leg. You need that muscle to actually stop your ACL. So when they're jumping and landing, their mechanics are a little different, and so they're more prone to tearing the ACL. There's things that you can do now when they're young women and young girls. They can do certain programs to teach them how to jump and land properly to decrease that injury. I see a lot of times something as simple as like an ankle injury. We twisted our ankle growing up. We just, iced it a little bit, threw a little tape on it. We got back out there and played. But what people don't understand is whenever you stretch and or tear ligaments and tendons, the body goes through a couple phases. It goes through that inflammatory process, the swelling, the pain, which you have to let that run its course, and you can help doing things to help that. But after that takes place, these tendons have now either been stretched or torn, and so they're weak at this point, the ligaments as well. So if you don't rehab in order to re-strengthen those, your ligaments and tendons will stay just like that. So then you run into issues where you have chronic ankle injuries, you twist your ankle more often, or you have chronic ankle instability as you get older, simply because you didn't put the time in to re-strengthen those ligaments and tendons. And I see that so often, that people don't train correctly, they don't condition correctly, and then after they're injured, they don't rehab correctly, and so they keep suffering from the same injury over and over and over again, and it's not going to get better on its own.
Yeah, I've experienced that myself after fracturing my foot. I want to say I had a Jones fracture in college, and I didn't do the proper training. I didn't go see the trainer like I was supposed to, but the trainer didn't reach out to me either. But that's not. It doesn't matter. I didn't take responsibility for myself. So when I got back and I was running, and my coach is like, "Why are you running with a limp?" And I'm like, "Man, I'm fresh off of surgery, man. Like, what do you want me to do?" So I didn't take care of that the proper way. You spoke on that, twisting ankles. I did that a lot in high school. But other than that, what are the most common type of injuries that you see nowadays?
That again also depends on the sports. We see definitely like a lot of lacerations or cuts, a lot of strains and sprains, so hamstring injuries, quad injuries, like we just talked about, sprained and twisted ankles. In certain sports such as like baseball, volleyball, you see a lot of shoulder injuries, or you see instability in the shoulders and elbow injuries. In my track and field, in my overuse sports such as like say track and field and things like that, cross country, you see a lot of like shin splints or stress fractures. And so it depends on the actual sport a lot of times, but those are the most common things that I see and treat a lot of. And it's funny because the most common injuries are the ones that I feel as though are less treated because people feel as though they're so comfortable with those. Now, obviously, we talk about like ACL injuries. I see a lot more non-contact ACL injuries in my female athletes. So again, you have a female basketball player, she on a fast break about to go up for a layup and her knee buckles. Or you got a soccer player, she take a cut on the field and her knee gives out. And so it's a lot of non-contact ACL injuries in young ladies. Men, we tend to see more ACL injuries when it's actually like a trauma. So, football, you get hit in the knee, or basketball, you fly, things like that. You see a lot of fractures as well, depending on, again, the sport. But those are a lot of the things that I see. And then even like recreationally, I got these kids now coming, hoverboards, skateboards, things like that. I mean, they all, especially when, coronavirus hit, these kids are outside doing things. We saw a ton of fractures, and then they're just doing different things like that.
Yeah, you kind of spoke on it. I'm gonna jump back to it. You spoke on the differences between girls and boys, but
Mhm.
we have a question from Lenora Funches, I believe.
Yeah.
Hope I'm saying that right. She says, "How long should her recovery period be, just in general?"
You mean does she mean it like in general? So like let's say if you practice, then how long should you recover? Is that the question, or is it more recovery after injury? I guess that would be.
I'm
I guess
not
I,
sure. I
I
guess
guess
you can
I answer.
answer both.
I guess I answer both.
Yeah.
So honestly, there is no. It's hard to say because there's no one answer that fits everybody, right? Because everybody's genetic makeup is a little different. People recover faster than others, and also your age determines how fast you can recover too. So the short answer to that is your body will tell you if you have, if you are still really fatigued and tired and your muscles are still really sore and aching, you may need a day or two to rest and recover. If you're injured, it depends on the injury. And so it depends on how long, again, to let the injury heal, whether it be a torn ligament or a fractured bone. And then after the injury heals, then the second phase of it again goes back to rehab. So then you have to rehab until you get back into game shape. And the topic that we'll probably discuss another day is the mental aspect of that. So a lot of
Hmm.
players, even though they physically are ready, they're, let's say, like Kevin Durant, for example, ruptured his Achilles. So he's been out over a year. Physically, he's probably ready, but
Hmm.
still have to get back in game shape. And on top of that, he's going to have to get back in mental shape. So a lot of people that have severe injuries or bad injuries like that, it takes them. Like Gordon Hayward, it takes them even longer to mentally get back to playing how they were playing for the fear of not getting injured again. But again,
Hmm.
for Lenora, it depends on, like I said, it depends on the body. So and again, your body can tell you, and that's why kids growing up, they are all different ages, all different sizes, all different aspects of development. Recovery for one child might not be the same for another. And so that's why you have to also pay attention to your athletes as individuals. But typically, you need at least 1 or 2 rest days a week, I would say. And then as far as the injury, like I said, it depends on the type of injury.
I hope that answers Ms. Funch's question. Let me get that out. Let's jump back to you said the difference. There's differences between boys and girls
Yeah.
injuries. You spoke on ACL for girls and stuff like that. Are there any other like big differences that you see in that?
Yes. So, and again, it's sports too. So, depending on the sport. So, for example, you know, most men play baseball, most women play softball. It can be a little overlap here and there. But for a lot of men, you'll see, overhead throwing when they're throwing pitches and stuff like that. So, you see a lot of
Uh
rotator cuff. You see a lot of labor issues, elbow injuries. For women in softball, though, it's not as prevalent because they pitch underhand, right? So,
huh.
so that's the difference. Also, there's a particular type of thing that young ladies deal with called female athlete triad. And so essentially that deals with they start to get a breakdown in their bones, so shin splints, stress reactions, stress fractures. They start to have abnormalities in their menstrual cycles, and they also get fatigue and things like that. So that has to do with more so energy coefficient, energy input and output. So there's something called disordered eating that women may go through. That athletes, I would say, not just women, but athletes have something called disordered eating that can cause that problem as well. And by that I mean, some people may think I'm talking about like bulimia, anorexia, things of that nature, but that's not essentially what disordered eating is. Disordered eating can be something as simple as you not putting back the energy in your body that you're putting out. So if you've been practicing all day and you forget to eat, well, that's disordered eating because your body eventually is going to break down. So I see a lot of young ladies that end up developing female athlete triad simply because either they're not matching the energy that they're putting out with the energy that they're putting in, and so that leads to a lot of injuries in young ladies. Again, young men, we see a lot more high energy collision athletes injuries because of the type of sports they play, such as the football and hockey and things like that. I will say this though, in my experience thus far, women's sports are a lot rougher. Like I've covered,
Absolutely.
they, women's they fearless. I mean, they are rough, they are fearless, and so I see when they do get injured, it's sometimes intentional just because they a lot of women out they play with reckless abandon. Like I'd be scared to go out there and play. I'm not gonna lie to you. I've covered women's basketball, women's soccer, softball. These women are aggressive creatures, and when they go out there and they playing hard and they give it their all, they are out there for blood and it can get nasty. And it's so fun to watch them. It's such a pleasure to watch them play like that. But the trade off When they get hurt, they get hurt. There's another type of injury you worry about too, and you see this mostly in kids when their growth plates are open. These are growth plate injuries. And again, this also goes back into overuse. This also goes back into rest and recovery. This also goes back to parents having their child play just one sport year round. In kids, growth plates are still open. So essentially what that means is kids they continue to grow up until they reach their adult height. Well, you can get injuries through your growth plate. So I see it a lot of times in gymnasts, or you see a lot of times you get, ankle injuries in kids. They will tend to have a fracture in their growth plate before they sprain, simply because the bones are weaker. And so if you overuse and overstress those growth plates, you can affect their growth for the rest of their life. And so I see a lot of growth plate injuries in kids that needs to be taken seriously. I see a lot of back injuries in my wrestlers, and my football linemen, and my volleyball players, and my field athletes, so javelin and things like that. They have a lot of spine injuries. And so it depends on the type of sport. And then there's some variation in the injury between women and men simply because of anatomy. And then also like the way that sometimes the sport is actually played.
You covered pretty much everything, and then let's the one injury, ESPN did a discussion about it, and there's a movie about it. I can't remember the name of it, but yeah, the big thing in football and hockey, and it can happen in other sports, man. Collision at home plate or whatever it may be, but concussions, man. I think parents sometimes don't realize how serious they are. So tell the people a little bit about mild concussions and severe concussions and how seriously they should take them.
Definitely. So the way I approach my parents and my athletes as far as concussions is essentially how I approach mental health in this country and in the world. It's hard to see mental health problems, right? Because a person can physically look great, but they're not okay inside. And so that's the same thing with concussions. Physically, they may look okay, but their brains are not okay. And so I try to relate it to them as, think about having a bruise on your skin. Well, when you get a concussion, it's essentially like a bruise on your brain. And, God forbid you got several concussions. Each concussion can be different. It depends on what area of the brain is affected. And so when you get into mild, moderate, severe concussions, that's usually subjective, and it usually deals with symptoms. And so there's some symptom score sheets that we usually get a patient and they fill out. And it's usually subjective. And so at the end of the day, like I tell parents, a concussion is a concussion, whether you want to determine mild, moderate, or severe. It's a brain injury, and we only have one brain. God was, great enough to give us a couple of duplicates of certain organs. Kidney, you get an extra shot at that one, but your brain, you only get one chance with that. And again, the same brain you have as a child, although it matures, develops, is the same as an adult and as an elderly person. So you have to take concussion seriously. The biggest thing that kids can do is rest. You need to rest. And I think most states have implemented at least a 7-day protocol where if a child has a concussion, they have to wait at least 7 days before they can return to sport. But certain states haven't. Actually, I think Alabama has not implemented that. So, some situations you got a concussion 2 days later, you probably could go back, and I absolutely do not do that. But most states have implemented where you have to sit out a certain period of time before you can even return. And so I tell them, they need to rest. They need to limit their activities. So teenagers and young kids, that's hard, because by that I tell them, cell phones, computer screens, video games, loud noises, bright lights. They need to eliminate that. They need to be in a peaceful, serene environment where their brains can settle down and just rest. I also tell them, you want to definitely be careful about certain medicines that you take, like anti-inflammatories. I typically don't use them right away. Again, because there's an inflammatory process that needs to happen, so I want that. So usually I do Tylenol if they have headaches. I usually you can give them a little anti-nausea medicine if need be, and I usually put them on like DHA or fish oil just to help with brain recovery. I also tell parents that, average time frame for concussion is usually 1 to 2 weeks before you can get back out there, but some people a little longer, some people a little shorter. You can't rush it. And it all depends on, the individual. Every concussion is different. And I also tell me the biggest thing that you want to be careful about if you send a child back too early, there's something called second impact syndrome. So if you send a child back too early and they still have swelling on the brain and they take a second hit, that hit can be fatal, or it can cause long-term damage or complications. And so if a lot of times it's tricky too, because sometimes athletes suffer a concussion, they don't know right away. So they may get a hit in the game and go back out there for a couple more plays before they actually realize they may be concussed. And so that's why I tell teammates, coaches, and staff, it's important for you guys to be paying attention to see if you notice any change in these athletes. And like you stated, you don't have to play sports to get a concussion. Matter of fact, you don't even have to have a direct head injury to get a concussion. All you need to do is have a situation where your brain can move, like whiplash, anything can, and that's that you can sustain a concussion that way. But they're very much prevalent, and I actually don't even think concussions are more prevalent than they were. I just think that we have the tools and resources to recognize them better, and we also have the tools and resources to kind of treat them and manage them better. Um, I don't have a magic number to tell you if you have X number of concussions that you should stop playing sports. There is no magic number. I think it gets to the situation where if you're starting to miss a lot of school or you're starting to have, a lot of residual effects from the concussion or, you know, things have changed or your behavior and, things that you suffer from it, then I think you have that conversation with your family and say, maybe enough is enough. But no, concussions are definitely real. Parents should definitely take those seriously. Children and athletes should definitely take those seriously. And it's nothing that should be rushed. They should go back when they're ready. There are some objective tests that you can do, like an impact and things like that, which is computer-based tests. And they coming up with a lot of different things now, like virtual reality type training and things like that now too, to actually make sure you're ready. And then lastly with that is, after an athlete, I think, is subjectively ready and I do my neurological exams and do my tests in the office, I usually always put my children through and my athletes through something called a return to play progression. So I don't send them right back out there to play. They have to pass certain tests and it goes in stages before I let them go back to playing, simply because physically, again, they can look okay, their brain can be doing okay, but sometimes symptoms can reoccur when you start back in activity. So I always put them through a rigorous training before I let them go back out there to see if they're actually ready to return.
Got it. I'm reading the questions somebody had, but I'm pretty sure I had a concussion at a young age, and I didn't know it. Doing something stupid.
When we were young, they told us we got our bell wrong. That's what we got.
Yeah, I'm pretty sure I've had plenty. A lot of my teammates, we had a dude by the name of Big T. I'm pretty sure he gave a lot of people concussions. So it's crazy how times have changed in just almost 20 years been out of school.
Matter of fact, high school, I had a clip with concussion. I apologized to him recently too because we were playing practice and I actually came down, elbowed him in the head. He was bleeding. I feel bad about it.
It happens, man. That's sports. So this person asked a question. Jaden Berry. He said, "What's the best?" I'm guessing he's saying, "What's the best age to start weight training for boys?"
So my personal philosophy, and again, if you ask 10 different doctors their opinion on certain things, you may get 10 different answers. But it's not necessarily weight training just for boys, but I like for my athletes to be skeletally mature. So by that, I mean I like their growth plates to be either closed or near closed before they start doing resistance weights. Then I'll let them do body weight. So sit-ups, push-ups, pull-ups. They can even do a little band work. But I like for their bones to be near mature or already mature before they actually start doing real resistance weights.
Understood. Another question from Angel. I don't know how to say the last name, so I'm not going to obliterate it like that. Longino, I think. He says, is there any personal protection equipment that you recommend for coaches and trainers to prevent concussions?
There is no guaranteed type of equipment that can prevent a concussion. Now, there have been recent developments in different types of helmets. And actually, there used to be a train of thought that mouthpieces did not help at all. But actually, there are now newer mouthpieces, newer helmets that can reduce maybe the effects or the chance of getting a concussion. But there is not one piece of equipment that you can use that can prevent you from getting a concussion. So essentially, it's just the way you have to look at it is it's an inherent risk that you take. Since we're talking about sports, but it's an inherent risk that you take when you play sports. There's nothing that I can do or give you to absolutely prevent you from getting a concussion. No.
Yeah, it's kind of one of those freak situations, I guess you could say.
And I think, like the NFL is taking a lot of different things now, with certain different things in the game that they're trying to change to prevent the chances of getting a concussion. They recommend certain types of helmets. And again, all of these things are to prevent the chances that they can happen and or try to decrease the severity of them. But there is nothing that anyone has developed to this point that we have that can prevent anyone from getting it.
Yeah, I totally agree. We're getting down to our last couple of questions, and I'm losing my light out here.
All right.
But you spoke on rest, and you spoke on recovery, and you spoke on stretching and things of that nature, and taking care of your body. Another thing that goes into that is eating the correct foods.
Correct.
Uh, what foods or food groups is best for athletes during the season? Then you spoke on the off season. What is the best type of foods that they should be eating while they're not in season?
And, and so I think obviously, I think obviously they should stay away from, obviously bad stuff. So, you don't want to eat a lot of junk food, fried food, fatty foods, things like that. A lot of times, even a lot of sports drinks are just contain with tons of sugar, and they're not even that great for athletes. And again, and I tell athletes like with Gatorade, things like that, unless you have worked up a sweat, there's no reason why you need Gatorade, unless you have worked up a dire sweat. And so, obviously you want to eat a lot of fruits and a lot of vegetables. You want to get your protein in and things like that to rebuild up your body, after workouts and things like that. And it's just really about a healthy balance diet. And it goes back to what I talked about as far as energy input and output. Out of season, you may not be putting out as much energy because you may not be training as much. So you don't need to eat or, fuel your body as much. In season, you may have to adjust your diet somewhat because you are expending more energy. So it's about energy input and output. And so you just want to make sure you're eating a balanced diet. You want to make sure you're eating the correct things. You want to make sure you stand away from, things that will affect your performance. So again, a lot of junk food, fried food, fatty food, soup, beverages, things like that, all of that stuff, you put it into your body is going to affect the way you perform. Another thing that I see a lot of young athletes doing is taking a lot of supplements. So, I'm in these locker rooms, these high school athletes these days, and all of them taking this pre-workout. And they jacked up in there, just jacked up. And again, I know when we were coming up, a lot of athletes, the big things like creatine, things like that. You got all these amino acids and branched chain supplements and things like that. I tell a lot of these young guys, you have to be careful with that. Again, a lot of these supplements, especially, a lot of them are not FDA approved, and how much that's worth to people. But also a lot of them, if you take them incorrectly, can cause kidney problems, blood pressure problems, and cause a lot of different issues. The other things too is like my college athletes, you have to definitely check what you put in your body because a lot of this stuff is banned by the NCAA. And so if you end up getting a random screen and you test positive, that can affect your eligibility. So, definitely be careful about the supplements that you put in your body as well. If you're eating a balanced diet and, again, and matching input and output, a lot of times you shouldn't have to take supplements like that. I know a lot of kids take because they want to bulk up and get bigger and things like that. And I also counsel patients on my athletes on that too. When your body is ready to put on that weight, it will. And honestly, when it does, you're not going to even want it. And so enjoy being able to have that body where you can compete. But a lot of athletes, like I say, they just, it's hard because they're so worried about the next man. They're worried about what the next man doing. What is he doing to do this? What is he doing to do that? But again, what's good for one person is not necessarily the best thing for another. So it's all about, nutrition has to be individualized. I always also too, if patients are able, I know we couldn't afford it when I was growing up. It's not able for everybody, but at some point, if people can get evaluated by nutritionists just to see, because again, what's right for one person may not be right for the next, but you need to put what's best for your body to get you to your ideal body weight, and it also deals with the sport you playing too. And so, if possible, I think it's always a great idea to talk to nutritionists to see what you should be taking in and out and things like that. And it's not always possible, but if it is, that'd be a good idea too.
Parents, hope you're listening. No, no McDonald's, no Burger King, stuff like that. Jack in the Box. I was real big on Jack in the Box growing up.
Oh yeah.
I haven't had it in so long.
Cheese, baby.
And so I'm real big on my athletes eating bananas, eating grapes and stuff like that. Any other fruits you recommend?
Like fruits in general are pretty good. You want to make sure, particularly I like the fruits and seeds in them. Those are pretty healthy for patients. You definitely, people talk about carb loading and this and that all the time. I don't necessarily know if that's, again, if you're eating a diet like you're supposed to on a regular basis, I'm not sure how beneficial that will be. But you definitely want to get, your fiber in. You definitely want to get your protein, your dairy. You want to get the food that you need to be able to compete. And so those are the things you really want to focus
Exactly. My last question. Well, maybe not my last question. um, in sports in general, we got football, basketball, baseball. Those are the main ones. What changes would you like to see, just in sports in general?
on. That's a good one. So, and again, I'm gonna just preface this by saying these are personal opinions for me in this.
Mm-hmm. Correct.
Honestly, I would like for, especially like my collegiate athletes, for them to be able to profit out some of their namesakes.
Uh huh.
And again, I see a lot of athletes. I know the situation I came from. I know the situation a lot of us came from growing up. To be able to get a college education obviously is a great thing, but it's hard to focus and it's hard to compete and it's hard to perform when you know back home your family's struggling to pay the light bill to put food on the table. So if an athlete is a brand, is a household name, and they want to make some money off their jersey or their namesake, I think it helped them to be able to stay in school, perform better in school, but also provide for their family. I don't see anything wrong with that. I also would like, especially like AAU sports and amateur sports, I would like for these sponsors and these certain coaches and certain organizations to stop taking advantage of these young children.
Absolutely.
Like in a sense, and I hate to use the term, I hate I hate to see them pimping these kids out. It goes
Mm-hmm.
back to what you're saying. These kids need to be kids, and they need to enjoy the benefits of playing youth sports without worrying about a business side of it. When they get to the professional race, they'll have all the business side of it in the world. But when they that young, that innocent, they need to just enjoy sports for sports. Um, I also would definitely like to see um, a lot of things you're seeing in the professional ranks now. So it goes back to sort of training, but they're doing a lot of studies on body, sleep, mechanics, things like that. I would like to start seeing that trickle down to the collegiate ranks and also eventually to high school and things because I think a lot of injuries start when kids are young, especially with the amount of sports they're playing these days. And I think they end up suffering from them later. So if all these things they're doing at the professional ranks can trickle down, I think that'd be very beneficial to athletes, younger athletes, to prevent them from getting injured so young, and to hopefully increase their chances of making it, to play whatever dream sport they want to play. And then lastly, as far as my athletes are concerned, and this is from our standpoint, I hope that our kids and our youth get away from thinking that sports is their only way to make it. Like
Mm-hmm.
I want to definitely get away from that. Like they can be whatever they want to be, and instead of using sports as a way out, just use sports as a tool. Like you don't have to be a basketball, football, man. You don't have to be an athlete. But if that's what you choose to be, no, that's a choice. But I don't want you to feel like you have to be forced that route because you have no other options. And again, that to me that starts in the community. We have to do better.
Mm-hmm. You have to understand that you're a student athlete.
Yep.
You can't play sports, and once you get to middle school, you can't play unless you're passing. But like we said earlier, at some point you're going to get old, and
It's
you have to
undefeated.
figure out what you're going to do after sports, and it's best to start early. And you also spoke on the AAU side of things, and that's why I've never really gone uh, sponsorship with some of these big
Yeah.
companies. Man, I'm a small time dude. And I just want to coach kids who want to play. I don't care about the rankings and all that stuff, man. Just let kids be kids, and once the ball goes up, and then we'll see what happens after that.
It's
Uh,
I know when I
but
was growing up, my granny said, sports, all that stuff, choir, sports, band, all of that stuff is extracurricular activities.
mhm.
If you can't get your curriculum, you don't need to do nothing extra. And so that has to be a philosophy to our kids. The other thing I would like to say, I didn't mention this too, is you kind of spoke on it. Like like you said, everybody at some point, I don't care if you're the best. LeBron's gonna have to retire here in a few years too. Like everybody, Jordan had to hang it up. Everybody's gonna have to hang it up. I would like to start them teaching money management, wealth management in these high schools to these athletes at a very young age. Even kids just going to college about debt management and wealth management at a very young age, so they can start practicing those habits when they're young. So when they do, you do get an 18, 19-year-old kid that goes to the league and they start all of a sudden you go from having $5 to all of a sudden now you have $100 million. That's
Uh,
a hard thing to drop in a child's lap when they've never had that before. So I would like to start teaching that, wealth management, debt management, money management, those type of skills to kids at a very young age, and then keep continuing that education through high school, through college. So by the time they do get to professional ranks, if they make it that far, they already have a foundation in place. And even if they don't make it, to a professional league, they still be in a place to better manage their finances for whatever they choose to go into. It is no reason that you should have you should have a career and you're making a decent amount of money and you end up broke. If you're a millionaire, you end up broke. There's no reason for that these days. And I think that definitely needs to be taught, and especially in the African American community. I think a big conversation now is becoming, generational wealth. This is, I think, that's where it starts. We have to teach our kids when we do, make it, whether it be sports or business or whatever you do. We have to start learning how to be able to leave stuff for future generations, so we don't have to start from scratch or even negative all the time.
Sport. I mean, money management is something that the community needs, and me and Jared, we talk about it all the time. The athletes are millionaires, but just think about the people that's running the team. Those guys are billionaires, so why not learn how to become the owner than rather just being a player? And I think that's great that you spoke on that. And
I think the athletes, they have to know their worth. And it's not just an athlete. I think we as people need to know our worth. But the athletes, since we're talking about sports, need to know their worth. These billionaire owners and managers, they can't do it without the athletes. And so the athletes, they need to learn how to become their own brand. They need to learn how to profit, and then once they do profit, they have to start making a career after. They need to start playing that early, career after sports. It's going to end at some point, and it's never too early to start playing for life after sports.
Never too early. I'm looking at some of this stuff, and then Shaston said, man, he called you Dr. Chuki. You can't get it out of it, but he said it's good to see you're making a difference and helping people out, especially by helping them take care of their bodies. Man, honestly, you've always been a good dude and keep making a difference.
Man, honestly, bro, Shaston, you guys, y'all just don't know, man. When I transferred to Houston, I was lost. I had a lot of issues, family stuff, and man, y'all embraced me, bro. Y'all put me on the AU team. Got my confidence right, bro. Y'all just don't know my stuff. You guys today. I know me and you didn't like me at first. Like,
I didn't like a lot of people, man.
It's good to see us. It's good to see us still, hanging in there doing what we love to do.
Yeah, exactly, man. I always gave people a hard time, man. That's just who I was. But it's obviously that you learned a lot, and there's a lot of PV folks in here, and they think they're the best HBCU ever.
Dude.
And you spoke on it earlier, the school that you went to, and I meant to ask you then, Dillard University, man, what does that mean to you?
Oh, who you root for? DU. Yes, that is. I owe Dillard University so much. I mean, they obviously gave me the education I needed to be where I'm at today. They gave me an opportunity to continue playing basketball in college, which, I didn't know if I would be able to do, but I did. Obviously, it created lifelong friendships, lifelong memories. And again, I'm going to go on my HBCU rant. It was such a wonderful experience to see people that look like you trying to achieve just like you. And again, you had people that looked like people from all walks of life that were interested in all different types of things. And honestly, I think that going to HBCU, it better prepare me for the real world. I'm able to go in any crowd and mingle and talk to different people from all walks of life. But Dillard is a special place to me. It's a special place. I'm plugging DU. If y'all, if young athletes are looking for a college, y'all looking for a home, a university, definitely check out Dillard University. It's in New Orleans, Louisiana. It's always a party, whether it's on campus or off campus. We have great food, great culture, great people. Dillard currently is an NAIA. However, we still play, Division I schools. We still have major competition. One of my good friends and my roommate and a brother of mine, he's still playing overseas to this day. His name is Alfredo Ott. So Alfredo Ott, congrats on your baby and marriage. But you can, again, if you have talent, you will be found. So definitely look into HBCUs, obviously Dillard University, but look at HBCUs in general to take your talents and your sports. You will not be disappointed. The experiences that you get at an HBCU are second to none. And I cannot stress that enough. I had some of the best years of my life at the great Dillard University.
I never got to experience. I took a different route, but it is what it is. I went where they wanted me, so it is what it is, man. But it's so great, man, to catch up with you. And it's been so long. We gotta stick together a little more. But my last question I've asked everybody that's been on here. You're the first non-coach that's been on here, but I know you're a huge sports guy, and we had a tragic ending to a person's life earlier this year, Kobe Bryant.
Yeah.
What are your thoughts on that guy?
Man, it's funny. I was at work. I was in the ER,
Mhm.
and I'm working. My wife called me. She said, "Did you hear what happened?" I said, "What you talking about?" She said, "Kobe died." I said, "Kobe who?" She said, "Kobe Bryant." And excuse my French. I said, "Bullshit," and I hung up the phone. I'm in
uh,
New York, and so I immediately started getting on the computer, looking it up, looking it up, looking it up. And it didn't say it at the time. His name just had a plane crash, but bro, I felt like I lost a piece of me. I felt like I
mhm.
lost a piece of my childhood, and honestly, I felt like I cried. I cried for weeks over there, and it would come in
Absolutely.
periods. And it's not just because he was a basketball player. It was for a lot of different reasons. One, he was a father. Now he leaves
Mhm.
behind those beautiful babies. And it's for the other people that died in that crash too. They were fathers and they were mothers and they were athletes. They were children. They were babies. And I just wept. And then I wept for the fact that I felt like Kobe. I felt like the best of him was yet to come. I
Mhm.
felt like him advancing women's sports. I felt like him showing us the father side of him, the human side of him, the business side of him. The fact that, so we mentioned that you can be more than an athlete after your career is over. I feel like the best of Kobe was yet to come, and we were just starting to really get a glimpse into who he was. And I tell you, I don't care if you were a Kobe nut or whatever. Everybody respected Kobe, whether you were a big fan of his or not. And if you weren't a fan of his, you loved to hate him because he was just great. I got him right under Michael Jordan, in my opinion. And I just, even to this day, I cannot believe sometimes that he's gone. Like I keep waiting for 2020 to reset.
Yes.
And like I say, his baby Gigi, to see that the relationship that they had and that fire that he had was transferred to her. I mean, it just, bro, I can't tell you. Like I still go through days where I just don't believe it. And
Uh-huh.
that again lets you know, one, you never know when it's your time. You never know. Number two, that lets me know that you cannot take moments for granted. You can't take for granted telling somebody sorry. You can't take for granted, telling somebody that you love them or that you care about them or that you're there for them or trying to make amends because tomorrow may not come. And they died in such an innocent way, man. They were going to play basketball. That
Uh-huh.
could have been any of us, right? Going to the park or going, they were just on their way to play basketball. And bro, I mean, it just gone too soon, bro. It's just tragic, man. Heartbreaking.
Yeah. It's still both of those things you just spoke on, and for me, it let me know that life was bigger than basketball because the world like pretty much stopped, and like people that never met him, never seen him, and just like you couldn't escape it. Kobe Bryant, his daughter, the other 8 people that was on helicopter, and it's just like wow. And I was on the way to basketball practice myself, and so it
Bro,
made me step
we,
back
we
and think,
we grew up with Kobe. It's not, it's
uh,
like Jordan. We were kids, we were
caught
babies.
glimpses, yeah.
We saw him, we learned about it more so later. We watched the games later on as we got teenagers. We started watching him. That was later on in his career. No, bro, Kobe was a few years older than us. That was us. Like
Uh-huh.
we start from the start of it in high school. Lord say, man, we start from his high school to the end of his career and everything in between into his life after. Like we grew up with Kobe, and it's like, and everybody did, and like through his
Uh-huh.
ups and his downs, he was human. He was non-human at times, like he was mythical at times with stuff he could do.
Uh-huh.
But he was, I mean, he just won an Oscar. Like I
Oscar.
mean, this guy was a savant. He spoke multiple languages. Like he was, I mean, a young, educated, gifted, athletic brother. And I think we should all aspire to do that. Again, it's more than sports. Like you can play basketball and be a Rhodes Scholar. You can play basketball and be a businessman, an entrepreneur, or play the instruments, or do whatever you want to do. And Kobe, he gave us that hope. Like all of us that have to hang it up one day, like, man, Kobe did it. We can do it. And then he just was gone. And it was like, it was no warning. It was like,
Yeah.
like it just it's heartbreaking.
Yeah. It's still tough, man. But I just want to thank you, man, for coming on. You reached out to me, or I reached out to you. Can't remember. But like I tell everybody, I want to thank you for your time, man, because it's something that you can't get back. But it's been special, man. I hope parents and players that watched and listened got everything they needed out of this. I hope you enjoyed yourself and whatever you got else to say. Now's the time.
No, I had a great time, man. And like I say, anytime I actually reached out to you, just letting you know, I just see a lot of athletes get mismanaged at a young age and have to deal with their issues later. So I just wanted to reach out to you to let you know, like, I want these kids to go and play whatever sport and accomplish their dreams, just to do it safely and healthy. But yeah, man, if you ever need me on, need any medical things and come talk about periodically, man, just let me know. I'm always available to you, man.
Man, I appreciate it, man. Until next time, people, we out.
All right, y'all take it easy.
Bye.